For more on the latest rise in COVID cases, let's bring in ABC News contributor Dr. Alok Patel. Doctor, thanks so much for joining us. Former White House COVID response coordinator Dr. Deborah Birx recently told ABC News that American leaders were living in a, quote, fantasy world about COVID in this country, not acknowledging how bad it still is. So first, just put this latest COVID wave in context. How bad is it compared to prior waves?
Well, Lindsay, we're in a much better place than we were comparatively if we look at hospitalizations and deaths. But we can't ignore the fact that hospitalizations are up 20% compared to previous weeks. And that's usually a lagging indicator of how much COVID is actually out there. So it's tough to say COVID is back when in reality, it never really left. We're just much better prepared to deal with it.
We'll talk about vaccinations in a moment, but first, do you think that we should be seeing people encouraging masking again in public and crowded locations?
I think it's absolutely a good idea for people to pay attention to their own individual risk factors, their symptoms, and where they're going. And it's never a bad idea to keep a mask with you just in case. It's better to be safe than sorry. The last thing people want to do is get COVID or the flu or RSV or any other respiratory virus when we're just trying to finally have a illness-free fall and winter season.
There's another COVID booster shot expected to roll out later this month, but is that at all coming too late in response to this current variant or to be effective against the latest variants that we could see this winter?
It is so hard, Lindsay, to thread that needle perfectly of when the right booster targeted towards the right strain is going to come out. But I think it's important for people to start viewing this almost like we view the influenza vaccine, where it's going to be tailored every fall to the best of scientists' ability to capture the dominating circulating strain.
And lastly, doctor, you know, there are certainly people who still are averse to taking these shots and feel that there may be other fallout down the road from them. What would you say to try to reassure the public who is still skeptical about the science?
No, I'm not surprised at all by the skepticism. We had less than 20% of people take the last booster shot. I think the important thing for people to understand is that we know that these shots are safe and they're effective and they're doing their job at keeping you away from severe illness, winding up in the hospital, or potentially getting someone else who's high risk. Now think about the cause and the risk benefit of getting a vaccine versus getting potentially ill. That's all you need to know. This is the first winter season we've ever had when we have a vaccine against the three deadliest respiratory viruses, COVID, influenza, and RSV. So we collectively have the potential to remove a lot of the disease burden we normally see, and that's something that we should all strive to do.
Dr. Alok Patel, always appreciate your time and insight. Thanks so much for coming on.
Lindsay, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.